Today we are going to talk about solitary thyroid nodule. The objectives of this presentation is to define what is a solitary thyroid nodule, what are the differential diagnosis of the thyroid nodule, and how to diagnose it and proceed with the diagnosis, and how to manage each type of solitary thyroid nodule separately. The solitary thyroid nodule is a discrete lesion with a thyroid gland that is palpably or ultrasonography distinct from the surrounding thyroid carcinoma. There's chance, 5% chance that it become malignant, and it is more common in female more than males. The differential diagnosis of the solitary thyroid nodule is either it is benign or malignant. But most of the solitary thyroid nodule are benign, so it is either adenomas, colloid nodules, congenital abnormalities, cysts, infectious nodules, and so on. And there is also the malignant type of the thyroid nodule, which is either follicular, medullary thyroid carcinoma, or papillary thyroid carcinoma. To diagnose the solitary thyroid nodule, you first should do the physical examination and ask the patient to swallow because a nodule thyroid gland moves up and down with deglutition, and also with the protrusion of the tongue. And there is also a sign and symptoms to look for, which is like hypothyroidism, tremor, overly active reflexes, and rapid or irregular heartbeats. To diagnose the solitary thyroid nodule, you should do tests and measure blood levels of the thyroid. And also you need to stimulate hormones produced by the thyroid gland to indicate whether the patient has hypo or hyperthyroidism. And you also could use ultrasonography, ultrasound high frequency sound waves to produce image of the thyroid gland. And you can also use a fine needle aspiration biopsy. Finally, the treatment of the solitary thyroid nodule, which depends on which type of solitary nodule you are dealing with. First type is toxic nodule. In this case, you need to do total lobectomy, only on one lobe. You should remove it all with the isthmus. Total lobectomy means that you should remove surgically the whole lobe with the isthmus. If it were simple nodule, you only remove the lobe, do lobectomy. And the same case goes for adenoma, but this time you should do total lobectomy. And of course the carcinoma, which is the most dangerous type, you should do total thyroidectomy. You remove the whole gland. And that's it. Thank you everyone, and I hope you enjoy and benefit from this video.